Hi, my name is Amy Childers. I'm a pharmacist here at Great Plains Health and the Medication Safety Officer. Today, I'm going to be going through some medication management information for the clinic nurses. I will be going through the associated packet of information and highlighting important information from each policy. It's going to take about 15 minutes, so thanks for tuning in with me today. The first policy I want to go through is the quick reference medication management for clinic settings. It's going to be the first sheet of information in your packet, and it's a great day-to-day reference to have around with you in your clinics. The one thing I wanted to point out is this: under safe injection practices, there's an injection preparation area section. When drawing up any injection, make sure to use a dedicated injection preparation area. Before drawing up your injection, wipe the counter with a purple top antiseptic wipe, wash your hands and don gloves, and then use alcohol pads to wipe all vial stoppers, including your multi-dose vials, before puncturing the vial. The next section is the medication storage guidelines in your packet. I just wanted to point out a couple of quick things in this sheet. Please note that controlled substances are the only types of medications that require a double lock. Also note that all sample medications distributed for patient use outside of the clinic all will need a retail style label on them before going out the door. That brings me to my first policy, medication use labels. An outpatient medication label needs to be provided for every sample medication that leaves the clinic. This label needs to include the patient name, the drug name and strength, directions for use, the pharmacy name and phone number. In this case, it's going to be your clinic name and phone number, the prescriber name, the prescription number, the fill date, the use by date or expiration date, which will usually be on the sample packaging itself, the drug quantity, and any appropriate auxiliary labels. The next policy I will be discussing is the pharmaceutical waste disposal policy. Under containers, you will see all the pharmaceutical waste containers carried here at Great Plains Health. First one I wanted to talk through is the black container for hazardous waste. Anything that is a P-list medication will need to go in these black containers. The most relevant examples are warfarin, nicotine, and phenol. All partial doses and even the packaging from any of these medications will need to go into these black containers. The other type of hazardous waste is incompatible pharmaceutical waste. These drugs must be returned to the pharmacy for disposal. Your examples are aerosol inhalers, silver nitrate sticks, and non-empty Botox containers. The next type of container I have with me today is a blue container. These are for non-hazardous drug waste, and this is the most frequently asked questions I get when I'm talking to clinic nurses about disposal. Any medication that is non-hazardous and is not chemotherapy can be disposed of in a blue bin. Common examples are capsules, any partial vials, ointments, and creams. Sharps cannot go into the blue bin, but any partial vial that you have left over, be it a partial vial of lidocaine that's expired, or any kind of partial vial of vaccine, ointments, creams, it can all go in that blue bin. That's going to be your primary drug disposal bin. Your red containers, you're probably already familiar with. Those are for sharps. This includes needles and any broken ampules. Your yellow bins will be for trace chemotherapy, and sharps can go into the yellow bins. For any partial vials of chemotherapy, we would use a separate kind of black container. And finally, your regular trash is appropriate for disposal of all non-hazardous, non-sharp, empty medication packaging. Your empty vials are a great example of something that can go into the trash. Any vial that is empty, doesn't have any leftover drug, can be disposed of directly in your regular trash can. The next policy is our sample drug policy. Each sample medication must be tracked as it moves into and out of the clinic. Each clinic may have a different log for this purpose, but the required elements of a sign-in log are the date of receipt, the name and strength of each drug sample, the lot number, the manufacturer, the quantity received, the expiration date, and the location where the samples are stored and dispensed. You also need to maintain a drug dispensing log. This includes the date of use, the patient name, the name and strength of drug sample, the lot number, the manufacturer, the quantity dispensed, the directions for use, and the physician name. You might notice that a lot of these elements for the sign-in and dispensing log are similar, and they're often combined into one form that you use to track your sample medications. Remember, anytime you dispense a sample medication, an entry into the patient's medical record is required to indicate that the samples were given to the patient, along with any appropriate information from the physician related to the use of the samples. The next policy is multiple and single dose vials. Each vial you use will be labeled as either single dose or multiple dose vial. A common clue to use to see if a vial is a single dose vial is sometimes they are labeled as preservative free or methylparaban free, and the abbreviations will be PF or MPF on those. That's a clue to know that it doesn't have any preservatives, so it will always be a single-use vial. Single-use vials should be used within 1 hour of opening and then discarded. Remember, if there's still medication left in the vial, it should be disposed of in a blue bin or a black bin. If it is empty, it should go in the black bin if the medication was hazardous, in the yellow bin if it was chemotherapy, or into the trash if it was neither hazardous nor chemotherapy. For multiple dose vials, these need to be dated with a beyond use date or an expiration date when they are opened. The beyond use date is 28 days unless otherwise specified by the manufacturer. If a vial is not dated, it needs to be thrown away. If it is labeled with the date opened, it needs to be relabeled immediately with the expiration date. Examine your multiple dose vials prior to each use for evidence of physical or chemical contamination. Dispose of the vial if you suspect any contamination at all. Remember to clean the vial stopper with alcohol each time a sterile device or a needle is inserted into a vial. The next policy we'll go through is the medication storage area inspection. So outdated or otherwise unusable drugs should be identified, removed from stock, and disposed of monthly. Remember, when we're talking about drug storage, all of your controlled substances need to be stored with a secondary lock. Medications requiring refrigeration should be stored in a medication-only refrigerator. No food or non-drug items should be stored in this refrigerator. Your refrigerator temperatures should be checked and logged twice daily. The proper temperature range for a medication refrigerator is 36 to 46 degrees Fahrenheit or 2 to 8 degrees Celsius. If your refrigerator is out of range, make sure to record what is done with the medications while the refrigerator is out of range and what steps were taken to resolve the situation. That way, if someone's looking at your temperature log record, they're able to tell that your medications weren't outside of the acceptable range for too long. The Great Plains Health Central Pharmacy can always serve as your backup refrigerator if you need storage. This policy is look-alike and sound-alike medications. Look-alike and sound-alike medications have a greater risk for error due to looking or sounding similar to another medication. Examples include Solumedrol and Depomedrol, or Humalog and Humulin. To prevent medication errors, we use tall man lettering in our electronic health system for these look-alike, sound-alike medications. So an example with your Humalog, the LOG is capitalized, drawing your attention to the difference between Humalog and its sound-alike, look-alike Novolog. Any look-alike, sound-alike medications should not be stored right next to each other in your storage space. So if you have more than one of these look-alike, sound-alike medications, you wouldn't want to store your Solumedrol and your Depomedrol right next to each other. That increases our chance of having an error with those medications. Your look-alike, sound-alike list should be included in your medication room so that anyone going into that room can reference that policy. So your look-alike, sound-alike medication policy has a full list of these medications, and I'd encourage you to go and take a look at that. Our next policy is our high-risk, high-alert medications. High-risk or high-alert medications are those medications involved in a high percentage of medication errors and/or sentinel events, and those medications that carry a higher risk for abuse, errors, or other adverse outcomes. Common examples include insulin, anticoagulants such as Lovenox, warfarin, and heparin, concentrated electrolytes, opiates, and many others. Please refer to your policy. Each of our high-risk and high-alert medications have an associated risk reduction strategy. An example would be our special hazard warning bags that are used for chemotherapy medications. If you're handling one of these medications, that bag is a great indicator that a lot of other precautions need to be taken with this medication. So each high-risk and high-alert medication is analyzed once a year, and we decide on special risk reduction strategies for each drug. Next policy is medication use bulk compounding. To ensure accuracy, when you're compounding, mixing, or drawing up a medication, make sure to compound in a separate area when possible. Minimize your traffic in your compounding area. Prepare only one drug at a time. Keep other drugs or labels for other drugs out of the work area. And clean and inspect your equipment between each compounding operation. The last thing I want to go through is calculations. There's a couple calculations on your quiz, and I'll just go through a similar one with you now. So for this example, we're going to calculate the dose of ibuprofen for a pediatric patient. Our patient weight is 14 kilos in this example. Our dose will be 10 milligrams per kilo. So to get your milligram dose, you're going to take your 10 milligrams per kilo times your weight of 14 kilos. This is going to give you your total dose of 140 milligrams. You know that your ibuprofen is available in a 100 milligram per 5 ml oral solution. I like to set up this problem as a proportion, and I take my available solution of 100 milligrams over 5 mLs is equal to 140 milligrams, which is our dose, over X mLs. This is what we're trying to find, is how much ibuprofen to give to the patient. So your X, if you cross multiply 140 times 5, divide it by 100, you get 7 mLs of your ibuprofen solution is equal to your 140 milligrams for your pediatric patient. Thank you so much for joining me today.